Other news for you this morning: where you live can have a major impact on your health, especially if you're diagnosed with cancer. For millions of Americans living in rural communities, getting specialized cancer care can mean driving hours for treatment, and research shows that those patients often have worse outcomes than people living in urban areas. Let's dive into this topic more this morning with Dr. Ronald Weigel with the American College of Surgeons. Dr. Weigel, it's good to see you this morning. Thank you, sir.
Thank you. Thank you for having me on your program, Dan.
You're welcome. So cancer patients living in rural communities tend to have worse outcomes than those in urban areas. Why is that?
Well, part of it's access. Sometimes they get diagnosed later, but access is a big problem. There's about 60% of rural counties in the U.S. don't have a general surgeon, and 2/3 of those counties don't have an oncologist. And so what we're doing with the American College of Surgeons Commission on Cancer is working to improve cancer care for patients living in rural communities.
And how are you able to do that?
Well, so what we do is we give hospitals the structure and know-how to improve the care that they provide. We have there's research that's been done that shows that patients that are treated at an American College of Surgeons Commission on Cancer are more likely to receive recommended treatment according to guideline care, as well as that's translating into improved survival. So what we're doing with the American College of Surgeons Commission on Cancer is improving the cancer care that patients can receive in their community.
How long has this rural cancer care gap been an issue?
Well, it's been an issue for a long period of time. The distances that patients have to travel, the fact that they want to stay in their community. A lot of rural patients really want to stay in their community rather than travel to the suburban or urban locations, even if they know that that care that they receive in their rural community may not be as good. So what we're trying to do is to bring high-quality cancer care through the American College of Surgeons Commission on Cancer to those rural communities and really change how those patients are taken care of there. And studies have shown that our program clearly improves cancer care for them patients in the rural community.
Any roadblocks you foresee in your pursuit here?
Well, I think the biggest roadblock is that getting hospitals to commit. Hospitals are struggling with decreased margins, but one of the things that our program does is it actually improves cancer care and can lower the cost that hospitals have for providing that care. So hopefully through programs like this, we get the message out that hospitals in rural communities, if they become accredited through the American College of Surgeons Commission on Cancer, they're much more likely to improve the quality of care for their patients, and it has a positive effect on those hospitals' bottom line.
Gosh, yeah, we were, just talking about some big layoffs here with Wellstar Medical Group laying off 700 people. They're Georgia-based that last week. It seems we're talking all the time, Dr. Weigel, these days about rural hospitals closing their doors. I'm curious, when you look down the road, 10 years from now, but then you also think about advances in technology. I'm thinking like telemedicine. Where do you see the rural cancer gap playing out a decade from now?
Well, yeah, technology is changing. Artificial intelligence is being used in ways that we can't even predict right now. But I think it's going to help lower the cost, at least that's our hope, by being able to look at an electronic medical record, populate registries, provide the data, and then use that AI to tell us and help inform us where should we be putting our efforts to improve care and really have an outcome improvement for those patients with cancer.
Dr. Weigel, my final question for you. We have a lot of rural regions here outside the main metro Atlanta core. If somebody gets diagnosed today with cancer in one of those rural areas, what should they be doing in 2026 to ensure that they get the best possible care?
Well, one of the things that they can do is they can look up where hospitals in their region are accredited by the American College of Surgeons Commission on Cancer, and they can go to facs.org/rural cancer. There's a lot of information there, including a list of hospitals in their area that are accredited, which is more likely to guarantee that they're going to get the recommended treatment, which translates into better survival.
Dr. Weigel, it's a noble effort, and we thank you this morning for joining us to talk about it.
Thank you. Appreciate it, Dan.